All right, this is it. I finally get to talk about the real things, not just be your MC. Now, don't get me wrong, you have been a wonderful, wonderful audience, but I also really like my day job. And so for the next 15 minutes, I'm going to talk to you a little bit about what I do as the Director of Policy at the Poverty Action Lab. I'm also going to talk to you about a lot of the things that not just I do, but the policy team does, the executive directors do, and most importantly, that the affiliates do every day other than research, which is trying to inform policy with their work. Now, I do want to say, put in a disclaimer out there. There are many, many ways to inform policy, and we don't claim that the ways we are going to talk about today or the ways we do it is either the only way to inform policy or the best way to inform policy for that matter. These are just examples of what we have found seems to work in the field. So I thought for today's presentation, I will first take you behind the scenes on how some of these initiatives to try and inform policy work. You will hear or have heard already about some exciting research projects and how these projects try and inform policy, how they change funding decisions, how they change program implementation. But today, I'll try and take you behind the scenes on exactly one of these initiatives. And then I'll conclude by just pulling together a few of the lessons, a few of the learnings that we are piecing together in all the dozens of efforts we make every year to try and move towards evidence-informed policy. So as you know, JPAL's mission is to reduce poverty by ensuring that policy is based on scientific evidence and research is translated into action. Now that is a great mission, but as soon as you get to the ground and start talking to policymakers, and I say this with all sincerity because I'm an ex-civil servant and ex-bureaucrat, so I was on the other side, that policy is really, really hard to change. And it's hard to change for a number of reasons. The first and the foremost is because institutions have constraints. Institutions have administrative constraints, which means rules and regulations. They have financial constraints. They can or cannot fund some programs. They have political constraints. It is possible to do some things in some countries, not at all in other countries. But it is also often because evidence is unavailable. That means nobody knows how to particularly solve a problem and has evidence around it. Or even when that evidence exists, it exists in academic papers or literatures, is not accessible to the policymakers. But there's a third reason why oftentimes policy is hard to change. It's because people are hard to change. Many of us are hard to change. Many of the people around the world are hard to change. And oftentimes, people rely on things like instincts, ideology, inertia. Things have been happening like this. Let's keep happening. What's the reason to move the apple cart? So the question then is, what really helps promote the use of evidence? Is good research in itself enough to try and change policy? Do you need to make the evidence more accessible? Do you need to just find receptive policymakers? Or do you need to just do lots of hard work and keep burning your shoe leather and eventually things will change? Or is it all a matter of just a bit of good luck? Let's find out. So there's a robust body of evidence which finds that deworming is a particularly effective way to increase learning outcomes in education and also to improve health outcomes. You heard Michael Kramer talk about the work he has done with Ted Miguel at Berkeley. Subsequent to their work, they founded the organization called Deworm the World. Now it is known as Evidence Action. And Evidence Action has worked to try and scale up this school-based deworming across many contexts. The picture that you see here is from a school-based deworming project that they did in Kenya in 2009, I believe. So the question that arises is, now that you have great research, proven in one context, actually also proven in other contexts. It was done in, there was a pilot done in Andhra Pradesh, which is on this map towards the southeast. You will see the state called Andhra Pradesh. How do you take those lessons and go to other places? Now, in 2009, this is somewhere around September, one of the states that JPAL had started thinking very seriously about working in was this southern Indian state, a northern Indian state called Bihar. Bihar is also one of the biggest states of India, a population of about 103 million people. and unfortunately also one of the poorest states of India. The reason for our timing was that there was a particularly good policy window. We had a new chief minister who had changed the entire dialogue in the state in the 3 years that he had been there towards development and growth. So we felt that we had the right policy window to try and go into Bihar. Now, this is where the hard work comes in. And a large majority of the hard work that we do is to really try and understand the context in which we are trying to inform policy. We are not going into a new context and saying, well, we did something there, it must have worked there, therefore let's do it here. No, so we really go with a very open mind, and we had series and series of discussions with people in the health department and in the education department to try and understand what exactly are the problems, the development challenges facing the policymakers in Bihar. What are some of the things they have tried? Why have they failed? Why have they succeeded? And what is it that maps between their challenges and the body of evidence that we have? And is there something that was successful in one context which may, and the stress is on the word may, work here? Now, through these series of meetings, one of the things that we started hearing from them was suspicion, hunches, thoughts in the minds of various health department people that worms are a problem in many districts of Bihar. The problem was the following. Nobody had done a widespread prevalence survey in Bihar, which would inform them, are worms really a big problem? How big a problem is it? And the second thing is that nobody had thought about doing yet, till that point, a very systematic and organized large-scale deworming campaign versus doing a deworming campaign in one district today and another district tomorrow. Thinking through with them, talking to them over the course of the months, we realized that this is a problem that requires cooperation and coordination between various departments, education, health, the chief secretary's office, and lots of permissions up to down. So we decided that one of the best ways to probably move forward is to organize a conference where we can inform some of the policymakers about the evidence that is out there and try and build a consensus on moving towards more evidence-driven policy. So you see this picture from January 2010. We are all standing there happily in Bihar with the then Deputy Chief Minister of Bihar. The person I want you to focus most attention on in that picture is the gentleman in the tie on the right of the Deputy Chief Minister. He happened to be the health secretary of this other state of India called Andhra Pradesh, the one that you see on the southeast corner of India. And a few months before that, we had done a policy, Deworm the World, had done a policy pilot with them in many of the districts trying to do deworming. So not only did we bring the professors who had done these evaluations, but we brought with, we invited to come with us the implementing partners with whom we had worked. And this is where good luck comes in. So remember, we've got a lot of buy-in from people at the mid-level and the people at the relatively senior level, but we need the senior buy-in from the chief secretary and the health secretary. And I'm wondering how that is going to happen. And of course, the health secretary of Andhra Pradesh, the gentleman in the suit, gives his speech. It is very well received. And in the evening, as I'm heading out, I see him walking out with the health secretary of Bihar. And I said, hello, what's happening, sir? And I did say sir because I belong to the same civil service that they belong to, or I belong to. And I said, what is happening? Are you guys, did you both get to know each other? He said, well, we got to know each other 25 years ago because we are batchmates in the civil service. So this is the point I just wanted to make, that it's often the case that you also need a little bit of good luck, not too much, but for those of you who are willing to have lunch with me, I will tell you about how getting him there was not a matter of good luck. So we have this conference, and at the end of it, the next day, we are having more discussions with the chief secretary, and the agreement is that let's go and proceed with thinking about whether deworming is the right option for us. So now we have got good research in place. We have got a willing implementing partner. We got our good luck. What was really missing at this point was somebody to provide the technical advice to bridge the gap on a day-to-day basis between good research and the lessons from that research and good implementation. And that is where Deworm the World, and now Evidence Action stepped in. It's an incredible organization which worked very closely with the government of Bihar over the next 1 year. And they work to do things like training the teachers on how the deworming pills should be given to the children in school, figuring out where the worm, of course, the first step was to run prevalence surveys in Bihar to understand what the worm load was. They did that, designing, planning, and executing deworming. All right, so we got all the pieces in there. So what does this all lead to? This is what it leads to and what makes it all worth it. 17 million children were dewormed in Bihar a year later. I just want to pause at that number for 1 second because sometimes we get immune to numbers. 17 million is more than the population of Greece and Ireland together. That is what working together between researchers, policymakers, implementing partners can do, and that is what gives me goosebumps every single day that I come to work at JPAL. And this is not just one story. This is a story that gets repeated over and over and over again. So I just wanted to give you a little bit background to the numbers that Mr. Jameel mentioned in the morning, 165 million people. This is the number of people who have been reached by the scale-up done by our fantastic implementing partners of programs that were evaluated by our affiliated professors around the world and found to be successful. So you see that 17 million children who were dewormed in Bihar in 2011, and then again Deworm the World / Evidence Action went and did a second round of deworming in 2012, and those are the numbers that feed into almost the 60 million children dewormed. Today, during the rest of the day, you already heard about Pratham, Rukmini, of all the slides that she had up there, she is so understated, and that is exactly the beauty of Pratham, that she never told you about the 40, that number is outdated, but she didn't tell you about the 34 million children that have been reached by Pratham and through its remedial education programs in India. You will hear from TNP2K, you will hear from Sudarno and from Ben Olken about the work they have done in the government of Indonesia. You will hear later Dean talking about targeting the ultra-poor program, so that green logo on the right, you will hopefully hear about Bandhan. You will hear Michael Greenstone talk about the amazing work that they're doing in environment, including with the government of Gujarat. Later on, during the government panel, you will hear Abhijit talking to the government of Chile and Felipe Cast about the Compass Commission work. You'll hear them talking to Martin Hirsch about the French Innovation Fund. But these are all some of the amazing partners who work not just for these scale-up numbers, by the way, but for various other ways that policy influence, that informing policy happens. So what are the general lessons that we are learning from all these efforts and all these attempts? That couldn't be my cue. I knew I would get a buzzer, but that couldn't be my cue. So one of the lessons which seems actually extremely obvious, but I'll tell you why it is not so easy to do, is that evaluations done with partners capable of scaling up the program provide unique opportunities for evidence-based policy. The reason it's not obvious is because it also means that these are very, very high-risk partners. Working with governments where governments change, politicians change, priorities change, people get transferred, you have to navigate bureaucracies and rules and regulations. It's extremely, extremely difficult. And that's why you will notice that the first few of our evaluations were not with the governments, but with NGOs. But over time, I think there has been an increasing amount of realization that if you want to reach a lot of people, you just have to take those risks. So you're going to hear later Karthik Muralidharan, who is a professor at University of California, San Diego, and talk about his work with Paul and Sandeep with the government of Andhra Pradesh, but they've also worked with the government of Bihar on scale. But sometimes you can have research which is so timely and so salient that it also almost scares me because it can help make me lose my job. And the reason it can help me help lose my job is because you don't really need to do too much and before you know it, it is getting adopted. And the reason for that is because it comes at a time when people are thinking about a particular issue, they're very concerned about the issue, and the evidence helps sort out the debate one way or the other. The example, we have many examples of that, but one of the examples of that particular research is done by Jessica Cohen at Harvard and Pascaline Dupas at Stanford, where they tried to look and see that should bed nets, these are anti-malarial bed nets in Africa. So they tried to see whether these bed nets should be given for free or should you charge a positive price for them. Now, for those of you who are in the health community, there's been a long-standing debate in preventive health. Should you charge a small little price before you give preventive health, or should you just give it away for free? And one of the biggest concerns among people has been that if you give it for free, people are not going to value it. If they don't value it, they're not going to use it. If they're not going to use it, it's going to be a complete waste. So let's not give it for free. Let's charge a little small positive price, which will make people value it. What Jessica and Pascaline found was that actually giving something for free does not decrease the probability, does not decrease its use, but greatly increases access. So in a sense, you are able to reach far more people by giving that product for free. So charging this little price is actually a barrier to adoption. And that research came at a time when many organizations like PSI had been debating whether to do this for free or to charge a positive price. And organizations like PSI, again, incorporated this in their strategy. And in many contexts where it made sense, they went to free distribution of bed nets. My third point here is that even before evaluations are completed, they help inform program design as part of a long-term engagement with our partners. And this is a point that often gets missed. We are not in the business of doing forensic evaluations. We are not in the business of doing an evaluation after the program has run its course and giving somebody a grade of A or B or C or D or F. We are in the business of trying to find out what programs work well and really trying to make them succeed during that process while staying independent about the results. So the example here is the work done by Nava Ashraf at Harvard and Oriana Bendiera at LSE, along with Scott Lee also at Harvard, with the government of Zambia. This is the project that Abhijit mentioned earlier in his speech. They have been working with them for more than 4 years on this particular project. The results have just started coming in. There are many more results which will take probably a few more months or maybe a year or more to come. But does it mean that the world, there has been no transfer of knowledge or informing policy? Absolutely not. Right from the design phase, researchers work with these implementing partners to design the best possible program to test it. The aim, again, is to succeed, not to give a report card. And this happens in each one of the 440 projects, including giving feedback through the monitoring group. My last example is from a research project that I was involved in along with Professor Rima Hanna at the Kennedy School at Harvard. And I call this the missing million, because when you see charts like that, you see the number of people who have been reached by programs evaluated and found to be successful. But what about the instances where we go in, evaluate a program, and find it to be not successful? Do governments or nonprofits or NGOs respond to the evidence? Do they shut down shop and say, well, JPAL came in and they found our results and they found that it doesn't work, so I guess we're all out of business? Do government officials say, too bad, let's just roll this program back? Well, maybe sometimes they do, maybe sometimes they don't. But in this particular case, Rima and we evaluated a project with the government of Karnataka in southern India. For any of you who've had IT troubles with your computers or laptops, that's the state where all your calls go. So we evaluated this program and found that putting biometric attendance devices, handheld devices, which measure attendance in rural healthcare centers does not help increase the attendance of doctors. So we go into this meeting, this is about 3 months ago. I go into this meeting and I'm all prepared to see disappointment, and I'm all prepared to see opposition and fighting and saying you must have done this wrong or that wrong. But then again, I think what really helped is this continuous process of giving feedback to the implementing partner. But we go in there and we tell them about these results. And we say that, look, the reason this program does not work is because you really need to relax the rules and regulations around this program, and you need to have the ability to take action against the doctors. Now, the government looks at us and we say, do you think you can do that? The government says, no, we don't think we are able to change the rules the way you want them to be changed. And so let's not just scale up this program. So this is a state where these rural healthcare centers reach about 37 million people. We estimated that the cost of the machines, just installing that machines, is only 1/5 is 5 times the cost of doing this evaluation. So if you just want to think about, even if you don't think about people or programs wasted, if you just think about the resources saved by evaluations like that, that's very, very powerful. So I just want to end by saying that we've just started scratching the surface and just started learning about how good research translates into good policies. And what really, really excites us about the next decade is to try and build a much more systematic body of knowledge on how do we inform policy even more than we have been able to in the last decade. Thank you very much.